We've got some news coming from Mpumalanga's health department about how their first day of phase 2 of the COVID jabs went, and they have confirmed to eNCA that some of their sites in Mpumalanga were unable to vaccinate. This is apparently because a liquid solution for the Pfizer vaccine was not delivered on time. Details of those who arrived to get the jab have been written down. They've been told to return Tuesday, as stock has now been made available. The Pfizer vaccine comes in a powder form and a liquid solution is needed to dilute it. So that's a bit of an update from Mpumalanga. But let's get more details generally about phase 2 of our COVID vaccine rollout. While some 700,000 healthcare workers still need the jab, work has begun to vaccinate the over 60 population as well. The program is being spearheaded by national government, but provincial governments and the private healthcare sector are working hand in hand to inoculate South Africa. And I'm joined now by Peter Wharton-Hood, CEO of the Life Healthcare Group. They run 66 hospitals across South Africa. Good evening and thank you so much for your time. Life Healthcare, it's a big hospital group. How are you assisting the vaccination drive?
Sally, it's been a cooperative effort with government right from the start. And in this second wave, or the second phase, we volunteered 11 of our hospitals around the country into the delivery of the vaccine. And in addition to that, have taken responsibility for another 457 secondary sites that we will also help to coordinate.
All right, so exactly how does that work? When you say help to coordinate, does that mean that you create the physical space? Do you also staff it, for example? Do you provide the computers to check the credentials of those who are getting vaccinated?
No, in effect, the secondary sites, we become the distribution hub. So we will store the vaccines in the special freezers that are required, and we'll make sure that they get to these secondary sites where the vaccination takes place. Our responsibilities around our primary hospitals, those 11 that I mentioned, that's where we make sure that we take care of the entire vaccination process.
All right, so are those 11 hospitals the primary sites that are vaccination sites? That is not just for private healthcare patients, am I right? That is for members of who would be part of the public healthcare and not only private healthcare. Is that correct?
Absolutely, and that's where the spirit of cooperation lies, that we are available, that when the EVDS system sends out a note to a public or private patient to arrive for vaccination, that we will take care of them in the designated place at the designated time.
Okay, so you have access to the EBDS computer system that national government is running, am I correct?
Well, that is controlled by national government. We do have coordinators that do talk across the systems, but we're heavily dependent on the people of South Africa responding to the instructions as has been given to them. It's absolutely critical that they wait for their electronic voucher, and it's absolutely critical that they wait for the designated time and place where they do need to arrive to get the vaccination. Otherwise, the coordination is just too difficult.
All right, so you've explained there's 11 hospitals where you are fully in control of the entire process of vaccination. Are all 11 of those sites up and running currently?
No, not yet. They're only fully up and running when the vaccine has in actual fact arrived. We will have one up and running by the 19th, by Wednesday this week, and the subsequent ones will be ready from the beginning of next week.
All right, so those are coming on stream fairly quickly within the next week or so. Then you've mentioned these 457 secondary sites, I presume also all across South Africa, and you say you're essentially the distribution hub. So what do you provide at those sites and what does government provide?
Government takes care of those facilities. We are just in place to be able to make sure that the vaccine is safely stored in our primary centre, if I can call it that, and makes its way to the secondary distribution site. And government takes care of the secondary distribution site.
So just explain that to me in more detail. Do you have the fridges? Do you have any facilities at the secondary site? Are the secondary sites yours, or are you simply moving the vaccines to those secondary sites?
Sally, you're correct. We're simply moving the vaccine to those sites.
All right, so that's going to be your main work then is going to be at those 11 hospitals as they come on stream in the next couple of weeks. How many people are you hoping to be able to vaccinate every day with those combined 11 sites?
Sally, this will be a learning process for everyone. We've typically calibrated our flow in multiples of 240. That relates back to the size of the Pfizer vaccine, shall we say, cases that they arrive in. On average, we'll be able to do about 320 in the initial phase, which means that Life Healthcare will be taking care of about 4,000 vaccines a day.
Okay, so each site roughly 320 jabs a day, so 4,000 jabs a day. Is that going to be at peak, or do you think it could go even higher?
No, I think as the learning process unfolds, we should be able to get faster, and as we get faster, we can do more in each day. Clearly, this is a question of balancing logistics and supplies, and we've thought through it both practically and conservatively at the outset, so we can get these processes to work. And as we get better at it, we'll scale faster.
All right, so those 11 primary sites where you're going to be administering the vaccine, and those 11 sites also distribute to the other 457 secondary sites. I presume those secondary sites are not yet up and running. Are you able to share details on where that phase is at?
Sorry, I don't have those details immediately to hand. I fully expect that rollout process to happen simultaneously with the up and running of our main sites.
All right. And does that include sites such as, we know that some of the pharmacy groups, or are these separate to the pharmacy sites that we're also hearing about?
These will be separate.
These will be separate. So we will have a lot of sites operating, but as you say, supply is a bit of a concern. We just heard that report from Mpumalanga. We know as well that we're waiting to find out about the release of the J&J vaccine. What are your biggest concerns being part of this? Is it about supply? Is it about whether you can scale up efficiently? Where are your concerns?
I think an endeavour of this size has never been tried before. So clearly what I'm looking for is cooperation, and to make sure that people understand that things may go wrong, but we need to move along together. So collaboration and cooperation, to my mind, is primary. There are lots of very knowledgeable people in the system. They're all trying their best. And if there are mishaps, and there have been mishaps in the other big vaccination programs around the world, let's address the problems and let's fix them. And in so doing, we can actually move this forward together.
Sorry to interrupt you. I just wanted to ask one final question, and that, of course, is around the issue of the third wave. The Free State and Gauteng officially in the third wave. I was wondering if you could give us an update on what is happening in your hospitals in those two provinces. Are you seeing any strain currently on COVID admissions to your ICUs? I'm thinking of your hospitals in Gauteng, such as Flora, Karstenhof, or in the Free State like Life Pasteur, Life Rose Park.
We have seen an uptick in admissions, but we are now in wave 3, having taken the lessons of waves 1 and 2. Our hospitals are properly prepared. The lessons that we've learned through the first 2 waves have been disseminated across all the hospitals in our group, so that we've learned from one another. The internal logistics and COVID planning is obviously meticulously thought through, with patient safety as the #1 prerogative. And in so doing, we are prepared for it. And it's not as predictable as one might presume, and we have to deal with the patients as they arrive.
Absolutely. Well, thank you so much for chatting to us this evening. That was Peter Wharton-Hood, CEO of the Life Healthcare Group, just explaining a little bit more about that cooperation between government and the private health sector.